Good morning, good afternoon, good evening, colleagues. Very warm welcome to this webinar. My name is Robert Jenkins. I'm the Global Chief of Education for UNICEF, one of the Associate Directors for Program Division. It's my great pleasure and honor to welcome you all to today's webinar. This is an opportunity for us as education stakeholders to engage on the framework for reopening schools. There was an earlier session on Monday on learning, and today, though, we're going to focus in on safe school operations. As we all know, the framework has been adopted, it's been shared, and it's being used in many countries across the world as we speak to plan and manage the reopening of schools. I would like to take this opportunity to give a special thanks to all our panelists who are contributing to today's discussion, and also all of you who've made time to engage, and I would encourage you all to engage in this discussion. We have four diverse presentations and panelists. The intention being that they will provide a context which we hope will be a very rich and engaging question and answer, which will follow the presentations, and we'll stick to time, be respectful of all the different time zones and also how busy everyone is at this time. We are recording this webinar, so I think it's important for us all to note that. We would encourage all of you to use the chat function to participate. Submit your comments, submit your questions via the chat function in Zoom, which I'm sure you're all familiar with. It's on the side there. And we will be monitoring these chat conversations, and we'll respond at the either one of the panelists will respond, or we'll open it up during the discussion following the panelists' presentations. So without further ado, we'll start with the panelists, and I'll introduce them briefly, and then I'll pass over to the first panelist. The first panelist is Dr. Stefan Peterson, the UNICEF's Global Chief of Health. He's going to present the latest evidence on COVID-19 infection and transmission-related issues regarding opening up schools. And then we'll pass to and welcome Elise Leonard, the Save the Children Safe Schools Advisor, and Lakshmi Padyal, Education Advisor and Cluster Co-Lead of Save the Children Nepal. And they'll talk about coordination and resources that are being developed for practitioners. Then following them, we'll pass to Matthias Lansard, the Chief of Education in UNICEF Senegal, who will showcase the efforts to date in preparing schools for reopening in Senegal as a case study. And lastly, I'll pass over to my colleague Lisa Bender from the UNICEF Education team. She's one of our key members that works on education emergencies, and she'll wrap up the panel portion and of the discussion, and then we'll shift to the comments and questions in the chat room. So again, please use the chat room for comments and questions. I'll now pass over to Stefan, who will lead who will be our first panelist to present. Stefan, can I pass over to you?
Thanks, Rob, and a pleasure to be with you, everyone. Thanks for inviting me. I'm Stefan Peterson. I'm joining you from Sweden, from my man cave, as you can see behind me. And now I'm going to share my screen here because I wanted to touch briefly now on schools and children in the context here of from a health perspective in these corona times as a framing of our discussions today. So in a few minutes, I just wanted to basically touch on three aspects. One is children's individual health. The second one, children and adults that are around them, teachers and parents and other things. And thirdly, school closures and openings versus slowing the epidemic, what we know about the relations. So without further ado, children's health. COVID is not a children's disease. Yes, kids get COVID, but the illness is mild for the overwhelming majority. I've scouted around to try to illustrate this, and I looked at France, which has data reported from the from the French Pediatric Society. And as you know, they've had widespread community transmission, and they have a pretty good hospital recording system. They've had less than 100 kids hospitalized for COVID altogether, and they've had 30 kids in intensive care with COVID, not necessarily for COVID. And in the case of my native Sweden, which has 1 million primary school kids that have gone through school throughout, with 2-3 months of community transmission and no lockdowns for primary school kids, but for secondary school kids, we've had over the 1 million kids in Sweden, we've had less than 50 hospitalized, we've had 22 in intensive care, not necessarily for COVID, but with COVID. And if we compare that to a respiratory syncytial virus, a bad virus that affects kids in their first year, we typically have between 50 and 150 kids in intensive care in Sweden every year because of a RS virus transmission. Although that is actually less this year due to the physical distancing and hygiene measures that we have taken. So at an individual level, COVID is not very dangerous. But then there's a rare condition, the multi-system inflammatory disease. It's Kawasaki-like. There's something called Kawasaki disease that is more common in Japan than elsewhere. And this is similar, but not the same. It is a serious disease, which is very, very rare, but kids recover. Sweden has had less than 10 cases so far. But yes, there are case series from around the world where there is 1 or 2 deaths from the Kawasaki-like illness. But then we must remember that regular influenza kills 2 to 3 kids in Sweden every year as well, except this year when influenza has disappeared. Now, that's on the COVID side on health. But then I also couldn't help but bring out that closing schools has health effects of different kinds. Confinement, mental health, safety, etc. And I think we've heard and read much about it. There is anxiety, there is acute stress, there is depression. This can have shorter effects. This may have longer term effects. We see increases in rates of violence and abuse in my native Sweden and around the world. And we hear reports from around the world of increasing teenage pregnancies in the lockdown time. So there are health costs on the health side of closing schools as well. So to my second question, what about the adults that are actually around kids that go or don't go to school? Well, initially we thought kids were very infectious, but actually the accumulating evidence is that they are actually much less infectious than we thought. And that if anything, it's us adults who infected kids rather than the children infecting us adults. There are a few studies and experiences around. Australia, and I'll give you the reference in my last slide here. We had 18 COVID cases across 15 schools, 9 students and 9 staff. And then they did all the contact tracing and all the follow-up and found 863 close contacts with these 18 infected cases. And that only resulted in 2 secondary cases getting infected from these 18 initial ones, both of them students, none of them teachers. Now, Sweden probably has the biggest natural experiment of keeping primary schools open and with community transmission, which we definitely have. So question was then, what about teachers in primary school? Are they affected more? So I actually have it now from personal communication from the Public Health Agency of Sweden that they are not. Kindergarten and primary and secondary school teachers have not been diagnosed with COVID-19 more than other professional categories that are compared against. So we don't see more than expected cases of COVID in teachers in Sweden, although they are in schools along with kids who actually lead a normal life, I would say, for primary school, not secondary school, by the way, which is closed. A report will be forthcoming of this with scientific data as well towards the end of the month. So thirdly then, we closed schools to slow the pandemic. And what about it? Well, does it slow the pandemic? Well, this is the experience, the daily cases, a 7-day moving average on the y-axis across time. And this is centered on the day, you'll see the 0 down at the bottom here, when various countries opened schools again after closures. And you will see that Germany, for instance, was on a downward trajectory of new cases. They opened schools and the trajectory continued down. But you may have read that in Göttingen, they had a party in a high-rise building, which gave a transmission, and they proceeded to close the schools. So that, not that it was that the outbreak was caused by kids or anything, but nevertheless, you can obviously have local outbreaks. And I know Israel has had a high-profile, high school level outbreak, which has closed schools locally as well. France was on a downward trend, continued downward, Denmark, etc., etc. So you'll actually see that you would have expected that 2 weeks after school closure, if the effect was dramatic, the curves would start up. But that's not what you see overall. And you see the link to this if you want to read and follow this more. So in conclusion, Rob and colleagues, these are a couple of references, and maybe I can ask the participants to send this out so you can actually get the links where you can read some of the more scientific aspects around this. But my conclusion is that no, it's not dangerous for kids to get COVID for the overwhelming majority, and it's not more dangerous than many other infectious disease risks that we accept for kids without closing down schools. No, the accumulating evidence says that kids do not affect and transmit very effectively to adults around them, including teachers, which doesn't preclude that individual teachers getting sick, of course, but as you saw in the case of Sweden, the biggest natural experiment, there is no higher rate. And thirdly, there is no community level linkage saying that opening schools speeds up the transmission. And in fact, this reference here that I'm circling here is a systematic review of the available evidence, which is a bit later, and the previous one here is earlier. And here's a third reference, all of them concluding that it's not children who are the drivers of this epidemic. Yes, they can transmit, but ineffectively, but it's time to reopen schools and send kids back to school and have much more nimble and localized approaches to infection and controlling the epidemic than nationwide closures of schools. Thank you.
Thank you very much, Stefan. Much appreciated. And indeed, we will share all the presentations with all participants following the workshop, and as well as the contacts of the panelists in case anyone would like to reach out and clarify and engage. Thank you very much again, Stefan. Let me now pass over to our next panelist, Elise from Save the Children. Can I pass to you?
Sure, thanks, Rob. Hi,
Great.
good afternoon.
Thanks.
Thank you. Good afternoon, good morning, or good evening to everyone. Thank you very much for having us here. I'm just gonna, let's see, set up the slide so everyone can see, share screen. There we are. Can everyone see the slides okay? I'm just gonna make them large and go back to the beginning. There we are. All right, thank you very much. I would like to first start by saying thank you to UNICEF, UNESCO, and World Bank for creating this nice online space for all of us to come together to discuss this very important topic of safe school reopening. My name is Elise Leonard, and I am a Safe Schools Advisor based out of Save the Children, Norway. And today I'll be presenting together with my colleague Lakshmi Podal. She is an education advisor as well as the education cluster co-lead based out of Save the Children, Nepal. So today we'll be presenting a new guide that was recently launched, an interagency guide called the Safe Back to School Practitioner's Guide. What is this guide? It is a guide that is meant to provide practical guidance on how to plan and implement an integrated participatory process for safe schools reopening. And why did the education cluster and the child protection area of responsibility come together and decide that we wanted to write this guide? The importance of this guide is we were all very much appreciative of the UN framework for reopening schools, and we wanted to make sure that it was something that would be easily able to translate to the ground level. And so this guidance is meant to be practical, provide key actions that will help make the UN framework come to life for children in every school all around the world. When I say we, which I'll say a lot on this presentation today, I am talking about a vast group of technical experts from all around the world and from all of these amazing agencies that you see below, who have come together from different sectors, education, of course, but also child protection, WASH, school health and nutrition, M&E, coming together with the best evidence that we have to pull together this one guide, 24 pages, that can help us put the UN framework more into practice on the ground. So I'll start by diving into a quick overview of the contents of the guide. The first part you'll see when you open the guide is an integrated checklist. This is a 6-page checklist, 3 pages for before schools reopen and 3 pages for after schools reopen, with key sections that are identified by colors. So for example, education is green, protection is purple, and for each of the sectors, what are the absolute minimum actions that we want to see these sectors taking to be able to prepare for a safe reopening process of schools. And it's really essential here that it's integrated because, as we know, COVID, it starts out as a health pandemic and it has huge implications for other sectors like education and protection. And now when we're reopening the schools, it's the education sector that will mostly take a leading role, but it's so key that we involve other sectors because the reinsertion into school will have a big impact on protection issues and health and WASH issues as well. This is an example of what the checklist actually looks like. We've really tried to make it quite user-friendly, so it really is just a box that you can check off that outlines the essential steps, and it will refer you to possible resources that have been curated by the experts that wrote this document, where if we think this is a good tool to give a bit more depth on a certain activity. So for example, here, it's an activity of procuring adequate WASH resources. What would adequate mean? You can click on those links and you can get a detailed list of what adequate resources we think are necessary for WASH in schools before reopening. The next part of the Safe Back to School Practitioner's Guide is a school-friendly checklist. This is a synthesized version of the 6-page integrated checklist that's brought into 2 pages. The audience is no longer program or coordination teams. It is more, it's geared at a head teacher, a director, maybe a school management team. It simplifies a bit the steps that are outlined in the 6-page integrated checklist. So see, there's a first page that brings the key points from each of the sectors into 1 page. And there's a second page with ideas about how to engage with key stakeholders in the school community. The first part being the whole school community. So it's questions that you can ask to ensure inclusion and participation of children, caregivers, teachers, school management, key community leaders in the back to school process. And the second section is for teachers. If you're a school leadership and you want to make sure your teachers really feel supported, encouraged, empowered to come back to school, then there's some key steps that you can find in that part of the school-friendly checklist. Beyond the checklist, we've also included technical annexes. There are 7 technical annexes. All of them but 2 are 1 page each. And then there's one that's 2 pages and one that's 3 pages. Again, we're really trying to synthesize the information that there's so much guidance out there right now about COVID and how to respond. And we really did make a big process of trying to go through the documents and pull out the best and most useful bits. So for example, this is the technical annex, a picture of the technical annex for MHPSS for children. And you'll see here that we've pulled out key messages of what parents and caregivers can do. There is a quick box on what the children can do to preserve their own or support their own psychosocial health, as well as that of their peers. And the messages there are very top line. And again, there are key documents that you're referred to if you want more information about that type of activity. And finally, just before we go to the next section, which Lakshmi will present, this is just to summarize that the Safe Back to Schools Practitioner Guide, it is a standardized text. It's based on our best international references and experiences from before, but it's absolutely essential that it is contextualized to be able to respond to the children's needs in your context. So for an example of how that's been done, we'll now turn over to Lakshmi for a Nepal example. Thank you.
Uh, Namaste. On behalf of Nepal Education Cluster and Save the Children Country Office Nepal, I would like to welcome all of you. Thank you so much for giving this opportunity to share what we have been doing regarding preparation for school reopening. Considering the times, I would like to directly dive to the main content. Ministry of Education, Science and Technology form a technical task team. So it's a representative from the UNESCO, UNICEF, World Bank, WFP, and Save the Children. We task team going through this UN framework of school reopening. Also, we review the documents, Global Education Cluster Shape Back to School Guide, and we also went to some of the example of other country. Referring to the international some of the tools and instrument, and we also discuss among the team what are the really action needed for the country of Nepal. Then the tax team prepared the draft document. We did two level of consultation, one consultation with local and province level government, including teacher union and key stakeholder who have been working in education sector. We did also a consultation with the federal level government. Also, this document translated into the English language and circulate with the all development partners, organization who have been working in education sector, and Nepal Education Cluster member. We have been, actually, we received lots of comments and feedback. Even today, the tax team, we spent more than 4 hours to incorporate this document in the draft document. Tomorrow we have a Nepal Education Cluster meeting. A representative from the federal level education cluster will be there. We are planning to share this draft document with them. Now, Elsa, could you go to the next slide? Next slide, please. I do not want to go in the detail about what are the content there, because we are in is the draft phase. Even we have been discussing about the title of the document. However, there are six section: introduction, objective, school reopening. Third component is really like a importance. We have been already figure out what are the area we need to take care before school reopening. And second section more about the area need to be considered during and after school reopening. Lots of intervention demands some financial resources. What are the role and responsibility of the local, province, and the federal governments in terms of management of the resources? The next section is related to the supervision, coordination, facilitation, and third section related to the conclusion. Could you please go to the next slide? During the process, actually, we have also drawn some of the lesson learned. I would like to share some of them. As in Nepal, we have 753 local governments, more than 35,000 schools. So there are a variety in terms of the capacity of the local government of the schools. In terms of in some of the geographical location, there are dense population of the children, and some of the location there are few children. Spreading of the COVID is also varied, and using school as a quarantine site, we also find differences. So in terms of capacity and other variables, there is also differences. At the national level, the tax teams today we actually discussed that we need to come up with some of the non-negotiable area. Maybe national guideline needs to be come up with a non-negotiable area for the school reopening. As in Nepal, local governments, they have authority to responsibility to manage the school education. So maybe from the national level, we need to provide some like a non-negotiable or the fundamental area. This set of things we have been doing. Many intervention demands the resources. So what's the role of the federal, province, and local governments and development partners and INGOs? So we have been discussing about this resource. Resource is the key. Third, as I mentioned earlier, national, federal, and province level government. So coordination is the key from the three tier of the government. Also government and the civil society organization. Also coordination between education, protection, health, and nutrition was is also the key. To really materialize this school reopening matters, teacher readiness is very much important. Similarly, parents need to feel very comfortable. They feel that, okay, my children are safe and protected if I send to school. Until and unless we do not create this environment, it's really difficult to reopen the schools. These are things we have already come up with this. This is very brief, like a sharing from the Nepal. If any question and clarification, I will address in this last discussion session. Thank you. Elsa, would you like to share this, like it's a different?
Yes, thank you. Sorry, just having trouble unmuting and finding the video. There we are. Thank you so much, Lakshmi. Really helpful to get an overview of the process that you've gone through in Nepal. Just to add, for those who are interested in learning more about the contents of the guide that has just been discussed, there are being organized regional webinars coming up soon. The contact information for how to join those is on the screen, and we can share that with you afterwards. The guide is available currently in English, French, and Spanish, and translations are happening right now for Arabic, Portuguese, Italian, and Turkish. Thank you.
Looks like we might have lost our moderator, Rob. He's having
so
some power
sorry.
issues.
No, I'm back. I'm back. My fault. Sincere apologies. Thanks. I was just having trouble clicking around. Thank you so much, dear colleagues from Save the Children. Very, very helpful, and we're going to have lots of engagement, I'm sure, coming shortly. Can I pass now over to Matthias Lansard, our Chief of Education in UNICEF Senegal, to provide a case study of Senegal. Matthias, over to you.
Thank you very much, Rob, and greetings to all participants from Dakar, Senegal. I'm Matthias Lansard, the Chief of Education at UNICEF. Let me share my presentation. Here we go. Oops, sorry. Okay, is it working? Can you see it?
Yes.
Anyone? Yeah.
Yes, we can.
All right, sorry about that. Okay, all right, thank you very much. So it's a pleasure for me to share a little bit, some insights from the Senegalese experience so far. As many countries, we've been planning for school reopening for quite some time. And just to give you a little bit of context, we had our first confirmed COVID case back on early March. Quite soon thereafter, the presidency announced the closure of all schools on March 15, initially for 20 days, and then it was extended further, and again to June, and it was supposed to start again, and it didn't happen. So we're still in a preparation mode in a way. So the other measures which are, I think, important to share is that, as in many other countries, the state of national emergency, and a curfew were announced. There was a closing of national borders and important travel restrictions, including between regions, and a ban of public gatherings and demonstrations. The school closure affected about 3.5 million learners countrywide so far. It's important, I think, to share how some aspects related to governance. There's a national and management team or platform which is multi-sectorial, led by the health authorities, but responding directly to the presidency. And there are regional crisis management platforms as well, led by regional governors at decentralized level. As far as the education sector response is concerned, it's primarily led by the ministries in charge of education. And besides the national response plan, there was an education sector response plan which we helped develop, which was mainly two focus areas: one around ensuring and restoring continuity of learning for all affected learners, and preparing for the safe reopening of schools. Some key considerations for deciding on when, where, and how. Quite early in the process, there was an important consultative process with various constituencies and stakeholders, led by the Ministry of Education, ministries in charge of education, but liaising with health authorities, but also other constituencies, including teacher unions and local governments, both at national and decentralized level. And it was very important because we all know all sorts of questions and concerns there can be around the school reopening. Important guidance tools we used with the government, and they were mentioned already, are about the guidance for COVID prevention and control in schools, which was published in March, as well as the framework for reopening of schools. In the context of Senegal, the capacities capacities to deliver distance education to all affected learners is pretty weak, and there was very little before the crisis started. So even though efforts are really important to try and expand access and deploy a number of distance learning strategies. This takes time, and during the time many children don't have access to education, especially in remote and rural areas or different certain specific populations. So reopening was really an imperative for equity concerns. But clearly, in those discussions, it's safety first. Social distancing, in particular, we're in a country where many classrooms are overcrowded. There are sometimes limited number of classrooms as such, and teachers as well. Then quite a significant proportion of schools which are operating as double shift schools. And a number of young children as well. When we think of children in pre-primary schools, it's very difficult to force social distancing measures on them, obviously. The second consideration, I think, which was important, is wash environments in schools. There's really uneven access to adequate wash facility and hand washing facilities in schools in particular. The last data we had before the crisis for Senegal, I think it's about 6,000 schools, primary schools, which don't even have a proper hand washing facility in schools. So it's an important aspect which was taken in considerations. And of course, tensions we can see on essential supplies, including with respects to masks, for instance, as the health protocol requires and expects teachers in particular, but also pupils from higher levels, to wear masks systematically. So several scenarios are developed with prospections depending on the epidemic situation, and the protocol for safe schools operation was also developed with health authorities. Given those, the strategy which was finally adopted was to organize a phased reopening process, starting with schools which accommodate examination classes to start with. And the Safe Schools protocol was also particularly written in a way to start respond to this to this first phase, and the idea was to see how it goes and adjust in the following weeks to extend and accommodate other levels, and especially for examination schools. And given the shortage of classrooms, sometimes the idea was really to mobilize all teachers in that particular schools, even those who don't necessarily accommodate children in exam classes, and to use all classrooms available as well, in order to split in in small groups and comply with social distancing requirements. Other measures which have been put forward includes the intensification of the deployment of distance learning program, of course, for the other grades, extending the academic year, postponing dates for national examination, also introduce additional exam sessions, especially as we're postponing exams in the year. And there's an upcoming rainy season which will affect southern regions, and an important point around the automatic promotion of learners from non-exam levels. So to respond to to try and enforce the health protocol, the safe school operations protocol, which was in particular which is requesting as an imperative for any school to reopen that they can provide adequate equipment, that they have adequate facilities for hand washing, access to clean water, and sanitations as well, separate latrines in good conditions. There was a call on local governments, communities, private sectors, development partners to support the preparations for school reopening in that regard. Given the travel restrictions as well, there has been a process of waiving of travel restrictions between regions for teachers, and organizing the transport so that they can come back to the schools for those who are far away, at least 1 week before schools reopen. Of course, cleaning of school premises and organizing supervisions and referral systems with the local health authorities, and procurement and distribution of essential supplies, masks, cleaning, hand washing equipment, thermometers, and communication campaign and upgrading of wash facilities in schools. Yeah. And we're almost there, and although we couldn't reopen as yet, there's a good chance this will happen in the coming weeks. Thank you very much.
Thank you very much, Matthias, and again, thanks to the other panelists as well. Very interesting, and I'm sure on behalf of all the participants, we're finding it very helpful. Can I pass over to you now, Lisa, and you can try and wrap up the various perspectives of the panelists. Can I pass over to you, Lisa?
Great, thank you so much, Rob. It's hard to follow those presentations, which were so specific to the data that's out there, the evidence that's emerging from experiences in countries that are opening schools or planning to open schools. But I did want to step back and give a slightly wider lens to some of the other questions that are being raised that haven't been answered yet, and also to look at some of the other guidance that's out there and the resources and tools that are emerging from around the world. So I'm just going to turn off my video here so we can focus on the presentation. I think that the most important point to emphasize really is that we're all in this together. This is an experiment on a grand scale, and we're all vested in the outcome. Many of us are parents ourselves and are concerned about the long-term effects of our children being out of school. But when we talk about safe schools, I think there's a real question on what does it mean? How safe? And what is going to be the impact on children and the impacts on public health? The data that Stefan has presented to us is incredibly useful in kind of saying what the evidence is to date. But I think it's also important to emphasize what we've learned from previous crises, with the Ebola crisis and the Zika health outbreak. And we know that situations can change fast as we're learning more about this disease and the implications of it, and I think the important thing for us to remember really is that there are many things that we do know. We do know that the longer children are out of school, the less likely they are to return. The government of Norway recently released a report stating that even the short-term closure is going to have incredibly detrimental effects to children over the long term on their well-being, on their life outcomes, and their economic outcomes. And if that can happen in one of the world's wealthiest nations, we can only imagine what the impact will be in countries that do not have those kinds of resources. So when we talk about safe, we're not only talking about safe from infection and disease, we're talking about safe from abuse and violence, safe from learning losses. And so we're talking about this holistically, and that's why it's been really interesting to see how approaches in Nepal and Senegal are shaping up to address the holistic concerns around children and their safety. So we'll go on to the next slide. Just a quick reminder that in addition to the practitioner's guide, we do have the guidance on COVID-19 prevention and control in schools. This is really aimed for school level planning, and again was modeled after similar guidance that was developed from Ebola and the Zika outbreaks. What's important to remember here is that everyone has a role to play, and this is one of the most important lessons that we've learned in terms of safe school operations. We need to reinforce and reinforce again that everyone has a role to play in promoting public safety. And so that means children themselves are incredibly important communicators and can disseminate life-saving messages in their homes and communities. Teachers are essential and frontline workers who need to be sharing accurate information and modeling safe behaviors. We also know that parents and community members need to be engaged in supporting their schools. And so just really emphasizing this message that we all have a role to play and that safe outcomes are everyone's responsibility can't be emphasized enough. We'll move on to the next slide. Within that guidance, there are some checklists that focus on operational issues. I think this is the kind of questions that we get again and again are some things that Elise and others have already touched on, but it's really about those specific actions. And this comes from a sense of wanting to control the situation and know that we're taking every possible precaution. And so we have developed some checklists on environmental health, and this is based on the best available guidance from the World Health Organization, the Centers for Disease Control, and other trusted public health authorities. And this talks about kind of the percentage of cleaning solution that's needed to disinfect surfaces, and the kinds of personal protective equipment that's recommended. But there are also measures that can be taken place that are very low cost or no cost, such as ensuring good ventilation, having classrooms that are outside, promoting behaviors, modeling good behaviors. That means coughing into your elbow and covering your sneezes. And so we need to be adopting the widest approach to these kinds of interventions in our schools. I'll move on to the next slide. Within the framework for reopening schools, again, this is a high-level framework that's meant to influence decision makers and policymakers, but people do still ask about operational considerations, and safe learning operations is one of the dimensions of the framework. And really the emphasis in the framework is around two major interventions, and that is reducing volume and reducing proximity. So with the volume, we do call out some specific actions, which have already been noted by other colleagues in terms of opening schools progressively by grade, progressively opening them by geography, opening those areas where there have been lower rates of infection. We also understand that there'll have to be approaches adopted around blended learning. That means some days in the classroom, some days learning from home. And so limiting the number of days per week that children are in school, alternating those days, alternating those weeks. There's a myriad of approaches being adopted. And in terms of proximity, we're really looking at staggering opening and closing so that children don't have to be as close to each other, they don't have to be in long lines, separating parents from drop-off points so that we don't have all children escorted, again, to reduce the proximity of people to one another in volume. We already see measures being taken to cancel assemblies, to modify any kind of recess, having children eat in their classrooms as opposed to cafeterias. So there are a number of specific measures. But what I think is really important to emphasize is there is no best practice. There's only emerging practice. We're learning everything about responses at the same time, but it will take some time to assess which of these have been most effective and ensuring that people have a sense of safety, but also that we are reducing infection rates. We'll move to the next slide. I wanted to emphasize the ways in which we've been working with the World Health Organization. So they did release considerations for adjusting public health and social measures in the context of COVID-19. This was a broad piece of guidance meant to help governments decide how to phase reopening of public services. And more recently, they've developed a specific annex on schools. And so we just want to highlight these resources. The specific annex does build on the framework and the guidance and the existing tools that have been developed by practitioners. And so this is a way, again, of ensuring that we're coordinating at the highest levels and ensuring that all of our efforts are informed by the latest evidence. We'll move to the next slide. A lot of the comments that are coming through the chat are really asking specifics about what's being done and what's working. And so we'll defer to our colleagues in Nepal and Senegal to speak about some of the country level experiences. But UNICEF is tracking the action of our country offices around the world. We've been surveying them in the ways in which they're supporting their governments and education stakeholders. And we've been trying to round up some of the emerging good practice. And so again, almost every country in the world is adopting some kind of localized, contextualized, safe school policy and protocols. And we know that at the core of those protocols are really coordination and communication. So in Sierra Leone, we see them setting up a task force with a multitude of stakeholders. The Thailand Safe School Network has set up a learning platform so that school personnel can learn from one another, share information, and access the best and latest data on safe school openings. We also see communities being mobilized to support safe school operations by ensuring there are necessary provisions at schools, supplies, and particularly things like water. Move to the next slide. In Syria, again, we see this sort of water trucking and distribution of key materials. There's a lot of focus on physical distancing or social distancing. And these are taking on a multitude of forms. In China, in pre-primary classrooms, children are wearing hats with long balloons attached to them to help them maintain physical space from one another. And so there really are so many practices being put in place. And again, it will take some time to see which of these prove to be the most effective in controlling infection and transmission of COVID-19. However, we can't emphasize enough that when we're talking about safety, that people's beliefs and people's confidence and trust in the system and the information they're receiving is just as important as the science. And so outreach campaigns with back to school, community engagement and consultation done in the safest ways possible will be essential. We'll move to the next slide. I just wanted to point out some of those resources that exist, many of which are linked in the practitioner's guide that was presented earlier, but we do have the 3-star approach for washing schools, and this is a progressive approach to strengthening water sanitation systems in schools, which is a critical resource for low water contexts and low resource contexts. We also have tools such as the compendium on group hand washing stations, and we use many of these methodologies to scale up responses during the Ebola crisis, and we didn't have any reported cases of Ebola transmission in schools. So we know that these approaches work. We know that this investment has high returns in safety and ensuring the confidence of teachers, students, and families to return to school. We also know that there are other kinds of risks to children, and so we wanted to just amplify the Safe to Learn campaigns, messages on safe school reopening, looking at ways in which bullying, xenophobia, need to be addressed in classrooms, that we're also ensuring that we're protecting children from any psychological harm or repercussions that may happen after they've been sick, or people in their community or family have been sick. So when we're talking about safety, and we're not just talking about operations, we are talking broadly about children's health and well-being. We'll move to the next slide. There are a couple of other things that I wanted to highlight in terms of emergent areas. In the center, you'll see what is a very common picture on any school morning. This picture is from India, and it's a small tuk-tuk van that is packed with children on their way to school. Obviously, now in the time of COVID, this is an area of real concern. So we are looking at ways in which we can develop guidance for public transport and look at ways we can diversify school transport methods to ensure safety. There's a group of stakeholders who are meeting on this next week, and they're hoping to develop supplementary content to the framework and the guidance on safe schools to ensure we are adopting the best practices. And this is an excellent moment to emphasize that when we reopen schools, we want to open up better schools. We want to open up safer schools. And previous to the COVID-19 crisis, one of the leading causes of deaths of children are road traffic accidents. So how can we use the COVID response to look at ways we change the ways that children go to school to keep them safer? And this is going to be a recurrent theme in all of our efforts, looking at how we can do better. In addition to public transport issues, we have a lot of questions coming to us around the specific provisions for young children. As Stefan highlighted, the good news is that young children are at lowest risk. However, we also know that they will have the most difficulty in complying with physical distancing measures, that it's more difficult to keep a clean and sanitized environment in preschools and in kindergarten classrooms. So our East and Central Asia office have developed guidelines, which you can see here on the right, and we encourage you to look at them. We know that there's some broader guidance also in development amongst key partners. Of course, we also want to remember safety considerations for the differently abled and for people with disabilities. UNICEF and others also have guidance notes on this, and so we just really want to emphasize again the need to consider vulnerable children, and particularly to consider marginalized children as we think about migrant children, refugees, girls, anyone who really faces systemic barriers to accessing equitable quality education. And with that, we'll go to the next slide, where I just wanted to highlight a couple of key resources. It seems that everyone has a resource slide, so we can consolidate these, but I wanted to really emphasize that the Global Education Cluster is maintaining an excellent database of resources, and the Interagency Network for Education in Emergencies is also maintaining a curated database of COVID-19 resources for the education sector. So I really encourage everyone to go back to these sites quite regularly to access information. And the link where you access this website will also continue to have resources posted by UNESCO, and UNICEF also has a dedicated resource page for COVID-19. So please come back often so that you can see the latest data and resources that all of our partners are sharing as we engage in this endeavor together. And that is the end of my presentation. So we're going to move into the Q&A.
Thank you very much, Lisa. And again, thanks to all panelists. So there are 360 people online, so this is going to be challenging. What I would really love, if we were all together, we could be engaging and debating and sharing experiences, but obviously that's not possible for a whole bunch of reasons. But the best way, what I'm proposing, the best way to manage our time now would be, and there's so many conversations taking place in the chat room and many very helpful comments and questions. I am going to get an opportunity to pass around to all the panelists. So I do encourage the panelists to skim through the chat and pick up some questions and comments they would like to respond to. But at this point, we'll pass over to Rachel. Rachel's a UNICEF colleague who has been scanning the chats. And Rachel, can I pass over to you to propose some suggestions on which topics we should zero in on? Basically, those that have had the most sort of traction or interest from the participants.
Sure. So I think we'll start with a couple of questions for Stefan, and then move on to a few questions for the other panelists following that. So Stefan, one of the questions that came in for you from Kenneth Russell is on the data on the effect of reopening schools. That it's for a group of very similar countries, generally wealthy ones, and that most of these countries would have strong school services, including transportation. And there are probably more countries like Madagascar than Sweden. So the question or the ask is that it would be good to know if there is any evidence on the transmission from non-school personnel. And I'll add another question on with that, and this comes from Xiaonan Cao, to ask about the need for a standard health kit for each school before it's reopening. And that such a health kit would be proposed to include essential hygiene and cleaning items such as soap, sanitizer, thermometers, and others. Are these kits necessary? And if so, what exactly are the essential items that should be included, particularly keeping in mind how important this is for low-income countries. And in addition to the health kit, how do we ensure safe play, especially for children in the lower grades, such as 6 or 7-year-olds? And maybe Lisa, you can come in on that last point as well. So Stefan, over to you.
Thanks. Thanks a lot for those questions and for summarizing, Rachel. I think, as you've alluded to, we have this crisis now has affected high-income countries first. And for lower resource settings, we are learning as we go along. Unfortunately, with actually schools closed in pretty much every country except Sweden, there's very little experience from other settings about transmission and the role of non-teaching staff, for instance, etc. But presumably, if you're in that enclosed tuk-tuk and 10 kids and one driver, and the driver has COVID, that's probably not a good thing. So yes, we need to learn on those things, and I think you rightly emphasized that we're not ready for a standard size fits everyone. I'd like to sort of emphasize, though, that I agree that schools should have certain equipment, and soap and water is the best thing you can have. I think it must be among the best inventions for health out there, short of sending girls to school. So yes, soap and water, and to be able to do surveillance here. Yes, it would make sense if a school has a thermometer, so you can actually check whether it's a perceived fever or a real fever, etc., since symptoms might be something we want to look after. I think this is something that should be built together with public health authorities in the sub-region, in the sub-national level where you're at, and so that, and you do build in surveillance, such as through temperature and symptoms, etc., in schools, and you consider and play along with the rules and how you play according to that. But certainly hand washing, distancing, and all of those things are very important at society level and in schools, and so on. Safe play. I think kids, it's impossible to do safe play. Either you play or you don't play. The evidence is that in those lower years, you don't transmit as readily between the kids. So maybe someone can think of something, but from a health perspective, if you play, you play. That's it, I think. So, but let me say that, and then I think you rightly, Lisa, pointed out that road traffic injuries is a big thing. And this is actually a chance to build back better. But I would also like to emphasize that we can't keep schools closed until everything is perfect, because then we may never open them. Foremost, though, I would like to say that it's a communication challenge, because teachers, parents, everyone is now scared after having been put to such drastic measures. So we need to communicate and allay fears, and that is probably equally important to the physical equipment and procedures we put in. And then we need to learn as we go along. Thanks.
Great, thank you, Stefan. So now we'll move on to some questions for the other panelists. So for Elise and Lakshmi, there was a question on how long the contextualization and development of the guide took. And also if you can share how you conducted psychosocial interventions in schools when classes resumed during or after during the pandemic, or depending on the country, as students start to return. So Lisa and Lakshmi, over to you if you can touch on those two questions.
Sure, Lakshmi, I think you might be best placed to answer those two.
Yeah. Actually, this contextualization of the guideline, as I mentioned in my presentation, basically this global education cluster guideline and the school reopening framework, we took a kind of reference document, but considering the Nepal context, the diversity in terms of geography and also capacity of the country, we actually took some like a reference those documents, but we governments together with the Nepal Education Cluster and other UN agency, we come up with the it's very much like a figure out one of the critical areas is coordination and collaboration between three tier of the government, as already mentioned, one of the panelists is making teacher like a ready. For in our context, this is one of the area. Another is like how to make local governments more responsible and accountable. The local governments, they have authority, but we have been preparing this guidelines. So we have been consulting with the local level government so that ownership will go to the local level government. This is not only the at the national level, we have also the challenges how to translate to a document this reopening framework. So what we have been mentioning in this draft document, maybe based on the local context, local governments they can decide whether the schools are really they are ready to for the reopening, but they need to follow some non-negotiable area. We have been working some of the checklists. Yeah. Secondly, your question is more about psychosocial counseling. Since from 17th March, all the schools are closed. None of the education institutions are open yet. So we have not yet practicing at the school level for the psychosocial counseling, but in the guideline, how we have been trying to mention at least this assurance of the psychosocial counseling for children and teachers is very much important, and we need to figure out the technical expert who really have expertise and list of the technical expert provide to the local level government and the schools, and also prepare the help desks in the schools. And in some of the contexts, not on the school, in some of the organization, we have been already practicing to the some sort of counseling through the phone contact, and also some of the mechanism of the referral mechanism if a context is more serious. Yeah, this is all from my side.
Okay, great. Thanks very much, Lakshmi. So now we will, so for Matthias, there's a couple of questions for you. There's a question from someone asking if you could share the experience and key challenges that may have been faced in Senegal or perhaps other countries in your region, some challenges that have been faced after reopening schools. So if you have any lessons you can offer from Senegal, or if other panelists want to come in with other country examples, that would be great.
Sure, thank you very much. I mean, unfortunately, we don't really have lessons learned from after reopening, because the school reopening process was postponed as such. But I think one of the key lessons learned from our side is that the education sector wasn't prepared to something like that, be it when it comes to ensuring continuity of learning in such circumstances. I think we've got Senegal is a pretty stable country, politically speaking, not so much affected by natural disasters as well. So I think there's a real understanding now that, I mean, we're talking about changing for the better, or building or opening back better schools. So I think clearly this is the process of extending distance education will continue after schools reopen, because there are also a number of out of school children out there, and adolescents and youth, who should have access to learning opportunities, and there are new opportunities in that context. The second one, and I think I've seen a couple of comments about weak and poor infrastructures and equipments in schools. I think even though for Senegal the national budget, 20% of the national, more than 20% of the national budget goes to education. Only 2% of the education budget, merely 2%, goes to capital budgets, meaning that for quite a number of years now, investment in school infrastructures, in proper equipment, especially wash facilities, has been neglected, and I think that's putting attention on the kind of attention and investment that would require to be made even after this situation or this crisis, after it's over. Yeah. Thank you.
Great, thanks, Matthias. And so now, Lisa, over to you. So I'm going to give you a few questions. So one question is on any standards that exist for safeguards requirements to ensure safe school opening. A second question is on experiences that might be able to be shared on TV teaching or radio during COVID-19. And I've seen in the chat that a lot of good examples have been shared there as well. So that's great. But Lisa, anything that you can add on that? And then a final question on understanding the meaning of education in emergencies and keeping in view the nature of the emergency rather than reducing the curriculum. So asking whether you suggest if teachers ensure children are taught with existing grade competencies, along with a focus on socio-emotional learning rather than simply moving on to the next grade. So Lisa, over to you.
Okay, great. These are really thoughtful questions. Thank you all so much. So first, I wanted to address the issue of safeguards and standards. What we're doing right now is framing everything as recommendations because, again, there isn't strong enough evidence about which interventions will have the best effects in reducing infection and transmission. We do have some lessons learned from previous health crises and just our good standard practice around WASH. As Stefan was saying, you know, we've seen rates of flu go down because people are engaging in better hygiene. And so we've seen this with the Ebola crisis as well. Diarrheal diseases decrease because we're increasing hand washing and good health behavior. So we know that this investment will have knock-on effects on children's health and well-being. And so we need to double down on what we know works as we continue to carefully monitor situations and collect data and evidence. And I think this is just such an important point for all of us, that these kinds of platforms are so important for sharing information, and we need to keep the discourse going. We need to continue to share what's working and be honest about our challenges and where we need to adapt our approaches as we respond to this evolving crisis. In terms of experience with TV, teaching, and radio, we are seeing a number of methods deployed around the world using television, using radio education, using WhatsApp chat groups, using telephone calls, using home visits, using printed out exercises to complete at home. So we see a myriad of methods being deployed, and many of these are helping to stem learning losses, or we assume so based on levels of engagement. We know that in some contexts, TV and radio is actually increasing access to children who'd previously been out of school, giving them opportunities to engage with educational content. And we hope this will lead to a greater interest in returning to school. However, the data is very clear. These kinds of learning experiences do not equate an in-school classroom presence. So much of what children learn in school is around social emotional behaviors, how to work in groups, how to have support from one another, to have the caring attention of teachers and other dedicated caregivers, and peer interaction are so critical to children's well-being and healthy development. So we do need to get back in the classroom as safely as possible and as soon as possible. In terms of the broader question on EIE and curriculum, this is an issue that we always struggle with. We know that previous to the crisis, we were having a learning crisis. There are too many children who can't read and write proficiently. We know that we've had a crisis in teacher education and support. We have too few teachers and teachers that don't have the right kinds of skills, training, and support to be effective in the classroom. That said, there are ways in which we can integrate life-saving content into the curricula. And there's actually an annex and some recommendations in the guidance on COVID-19 prevention in schools that suggest ways that we can do that. So we need to look at ways that we can integrate critical health messaging into language arts exercises, into grammar exercises. We need to ensure that science and math include content on safety and understanding disease transmission. So there are ways that we can try to utilize the instructional hours we have to greater effect, integrating content related to the pandemic. And we've been pushing for this a long time ago in our risk of informed approaches to education. So it's not just about the pandemic that we're facing now. We know that many countries will face compounded risks as we move into cyclone seasons, hurricane seasons. There will be other kinds of natural disasters, conflict, social unrest. And so we need to look at all the time how we can serve children with relevant information for themselves and for others. Thank you, Rachel.
Great, thank you, Lisa. And now, Rob, we have a question for you. So the question is, due to the economic crisis, funding will decrease for education. However, we'll need an increase in funding to support remedial efforts. What strategies can we employ to minimize investment losses and learning losses? So Rob, any guidance you can provide on that question would be great.
Thank you very much, Rachel, and thanks for the question. Indeed, I've been in many conversations. I think probably many of the participants on this call have been on the concern around public resources for education, how to protect it during these trying times. Now, they're trying times in a whole bunch of ways. Let me just be really quick. One is, of course, with the challenges broader facing economies in the broadest sense, we'll have a smaller pie that we'll need to be allocating in terms of then knock on to government resources. Then within that smaller pie, very reasonable to expect governments to prioritize restarting the economy, social protection systems, and health, because of course this was a health crisis. And so what's left in terms of the remaining large government allocations it's going to be education. So being education people, our reaction is to advise governments and to continue to engage with all colleagues to say, let's not compromise medium and long-term future of children, of students, of young people, but also of economies and communities by defunding or reducing funding to education in order to meet very short-term practical fiscal constraints now. So continue to have our eye on the ball on medium and long-term positive change and economic growth, and that will require continued investments in education. In terms of the specific balance between formal education, remedial, striking that right balance, we quickly move to context specificity. It's very difficult at the global level to be crystal clear on where is the right balance between those different modalities and how should governments prioritize those different modalities. We would be inspired by the principle of working with all partners to ensure every child has the resources and access to learning opportunities to realize their full potential. And every child with limited resources of government and partners would necessitate us prioritizing the most vulnerable in order to maximize our impact. With that, Rachel, I'll pass back to you.
Great, thanks, Rob. And Elise, I believe you wanted to come in to follow up on some of the questions that were geared towards Matthias as well. So Elise, if you'd like to come in now, that would be great.
Sure, thanks so much, Rachel. Just wanted to emphasize the importance of building back better that Matthias and Lisa both had been able to start emphasizing. In the Safe Back to School Practitioner's Guide, we do have an annex at the end. It's number 6, I believe. No, 5. That has guided activities that communities can run with their school when the school is in the process of reopening. So their activities to be able to work with whole school communities, again, children, caregivers, teachers, school leadership, and key community stakeholders, to identify different risks that the community faced while schools were closed and as the schools were reopening, and to identify different resources or solutions that are community-based to respond to those. And the second activity is about preparing education and protection continuity plans. And it's a very simple form that the school community can work through together to fill out, next time the school closes, if there is a secondary outbreak of COVID, or if there is another emergency that emerges like a cyclone or an outbreak of conflict, what are the steps that our community can take to make sure that the disruption to education and to protection that has occurred with COVID won't be as immense next time? And if I still have the floor, I would like to just share a bit more about the MHPSS aspects of returning to school. So there were a lot of questions in the chat about preparing the community, at both the children, and I think it was Rob as well who mentions the importance of preparing the adults as well. In the guidance, you'll see, let me see if I can share my screen one more time. There are many different elements of the for MHPSS, there are key messages that we really do want to get across when we are preparing the community for returning to school. First are, as you'll see here, facts about school reopening. So when is school reopening? What's happening? What are the key steps that schools are taking to make sure that the school is a safe place, both for health reasons and protection? Facts about COVID. There's still a lot of misinformation out there, especially related to stigmatization. And then there's also some key elements about what parents can do, how they can talk with their children in a very psychosocially supportive way, taking the time to ask their children, what is it that's making, how are they feeling about going back to school, identifying those emotions, putting plans in place that the child feels safe in this process. So these are really key activities and really key messages that we should be trying to get out there to our school communities as schools are reopening. Thank you.
Elise, thank you so much. That's so helpful. And I just wanted to emphasize that on Monday, June 15th, we'll be having a session that's dedicated to well-being and protection. And we will have someone from the Mental Health and Psychosocial Collaborative and Interagency Working Group speaking about support for mental health and psychosocial issues. So if you're interested in this, I encourage you to please join us on Monday. And again, to say that a lot of the trauma that's being induced by this crisis is a sense of lack of control, fear of having too much information or not having confidence in the information that people receive. And so by implementing protocols and sharing information, engaging with all of the different stakeholders, it gives everyone a sense of agency, particularly young children, when they feel like so many things are out of their control, when they know what they can do to keep themselves and others safe. That will actually really reinforce their well-being. So with that, I think we have some additional questions. Over to you, Rachel.
Great, thanks to you both. So I'm going to open this up to all panelists, and these are a couple of questions related to teachers. So the first question is, what should be done when teachers oppose going back to class? And this is taking into consideration teacher unions, which are creating virtual strikes in some places in order to show their disagreement regarding going back to school. So what should be done in those situations? And then the second question is, are there any protocols for teachers to take appropriate safety measures for children and themselves before reopening of schools, training of teachers and others? Considering that before reopening schools, training of teachers and other school staff should be mandatory. So I'll open that to whichever of the panelists feel like they would like to answer these questions on teachers.
I'm happy to take a start. Or go ahead, Matthias.
No, please go ahead, Elise.
Okay. Yeah, we can tag team then. They're really wonderful questions, absolutely essential to make sure that teachers are understanding how that they're feeling empowered and they're feeling supported in coming back to school. I can say that in the Safe Back to School guidance, we've included some key steps that would be recommended for school communities to support the teachers. And there is a drafted training that we think is some of the best examples of how we can support our teachers for coming back, that can be run face-to-face or remotely through WhatsApp with teachers on basic COVID information, also teacher well-being for them to identify what their needs are and how they can support themselves. And then secondly, some basic PFA elements, how they can respect or support their students as they're coming back. So there's a lot in Annex, I believe it's 3 of the Safe Back to School Guide. Over to you, Matthias.
No, thanks, Elise. And I just wanted to share also, I didn't really say why the reopening of schools didn't happen on the 2nd of June as initially planned in Senegal, but the reason why it was postponed is that quite a number of cases of contamination were reported among teachers also, just because just before the schools were due to reopen, and that led to strong concerns and oppositions from teachers unions and communities as well, and that's why the government has decided to postpone the situation. I think again it's important, as much as we need to reassure parents that that school reopening is safe, we certainly need to dedicate time and attention to teachers, because we need to convince them of the same as well, and I think providing also masks to teachers whenever that's possible. I think that's part of the equation. I think Stefan referred to also the different mechanisms that should be established, possibly in schools, including to survey in terms of surveillance and identifying symptoms and preparing schools as to how they should respond to suspicions of infections, in terms of case management in a way. So yeah, that's what has been happening so far in Senegal. Thermometers have to be, and that's a key requirement, have to be present in every school, so that we can check on temperature before when children or teachers come in and out of school. And also, I mentioned that, but I think it's important also to make time for teachers so that they can prepare for reopening as well, having them present at school for quite some time, a few days before, so that they can really kind of practice also social measures, social distancing measures, and working that out with all teachers and the school administrator. It's an important process, and that's important to make proper time for that.
Great, thank you very much. So now I'm going to open it up for another question for all of the panelists. And the question is, what should be done when schools have been used for quarantine or as health centers? And this will be a quick round because we're running short on time here. So who would like to jump in on this?
Stefan, a very quick answer. I think obviously you do some disinfection and cleaning, and that should be it. But as we know, there's good evidence that this virus does not live forever. But let's add some cleaning to reassure people. This virus only survives a few hours on wood and metal, etc. But let's add some cleaning to reassure everyone. Over.
Great, thanks very much, everyone. And we had a lot of questions come in over the chat and on YouTube also. So we'll be answering some that we didn't get to in the summary for this session. So now I'll hand it back over to Rob to close the webinar.
Thank you, Rachel. I think I will just see if there's any concluding comments, maybe just quick, a couple sentences, a few sentences from each of the panelists before I close the session. We just have another 4 or 5 minutes. Shall I pass? Maybe we'll go in the order of the speakers just to keep it simple. Stefan, any quick final comments?
Well, in this life, there is nothing which is dead sure. And certainly there are uncertainties here. We've scared people quite a lot. So now we need to reassure people, and then we need to be vigilant, and we need to be sure, actually be convinced, understand that we are balancing risks here. Personally, I'm convinced, looking at the medical evidence, that the risk of keeping kids out of school is much, much bigger than the one of keeping them in school. So let's be safe, let's go back, and let's learn. Thank you. And remember to communicate.
Thank you. Very important points. Share your perspective, Stefan. Can I pass to you, Elise and Lakshmi?
Thank you very much. Just want to build on what Stefan's saying. It's absolutely the sentiment that I would like to put forward to the group right now. Really, this is an opportunity, these school reopenings, to build back a better system, work together, a truly integrated approach for safe schools. We really need education protection working together, as well as health, school nutrition, etc. And it's a wonderful opportunity to really elevate the voices of children and get children in the driving seat for some of the participation in the reopening process and engaging in the school community and school improvement processes. Thank you.
Thanks for Lakshmi. Yeah, please.
Yeah, just add on to the ads. It's definitely integrated efforts is very, very essential. Link with the protection, health and nutrition was is the key. Education alone cannot do the everything in the reopening the schools. Similarly, alternative modes of education, we need to also link with the alternative mode of the education while we talk about the school reopening. Third point for me is very important to we need to special take care how to address the issues of the most deprived and marginalized children's preparedness of the parents and teachers are the key. Thank you.
Thank you very much, Lakshmi. Matthias?
Yeah, I think Stefan said it all. I think there's the prolonging school closure can have much more adverse effect than reopening, and I think we need to be pedagogical and really engage with parents in all the communities, and focus on not just on school reopening, but building schools better in the long run. Thank you.
Thank you, Matthias, and thanks again for all your contributions. Lisa.
Yeah, I would just say that it's been great to speak with you all, and that this is really an opportunity, as is every crisis, to put children's rights front and center. The right to education cannot be diminished regardless of any crisis. We need to find ways to keep children safe and learning. Thank you.
Thank you. Thank you to all. Thank to everyone all over the world who's taken the time out of their busy schedules to participate in this webinar. Lisa Bender, Rachel Cooper from my UNICEF team, thank you so much for all that you've done to organize this and all that you do on a day-to-day basis to advance these important issues. Thank you so much to the panelists for being so concise, for being so substantive. Thanks for all the contributions. To just think the strength of all 300 of us now working forward, working together to advance the efforts to enable all children to learn throughout this world during these very challenging times. All the best to everyone. Stay safe. Thanks again. Take care. Bye.
L'enregistrement a été interrompu.